I'll go ahead and turn it over to Rotarian Dr. Lawrence to introduce our special guest speaker today.
Thank you. Before I do that, I just want to say Mark is the guru for all things fundraising, creative and innovative in terms of coming up with wonderful ideas on how to just raise money in a very short amount of time. So really respect him for that, and honored to have played a role in it as well. But personally want to thank you, ma'am, for the check for the dorm students as Dean of Students, and for the other contributions that this particular club of ours is presenting to many folks out there, many students out there. That'd be great. I mean, that is a great thing. So I really appreciate that. And then finally, Mark, I do have I owe you 5 tickets worth, so you can add $250 to that pot as well. And continue to get hopefully we get the rest from the others. But just want to kind of mention that. But let me go ahead and say half a day and good morning, Madam President, again, and fellow Rotarians. It is indeed an honor for me to introduce today's guest speaker, Ms. Aja Ramos, who has and continues to serve countless individuals for over 20 years now. You know, as a licensed clinical social worker, she has worked in various roles dealing with youth and families from diverse backgrounds. She has helped build resiliency among individuals who face barriers, including trauma, abuse, chemical dependency, severe behavioral health disorders, developmental disabilities, homelessness, and even domestic violence. Prior to her position with WesCare Pacific Islands, Ms. Ramos worked for the largest behavioral health organization in Washington state. And while there, she delivered crisis intervention, therapeutic counseling, case management, interdisciplinary team facilitation, and even client advocacy services. In 2019, Ms. Ramos was selected as the Social Worker of the Year by the Guam National Association of Social Workers. In addition, she served as chair of the Guam Board of Social Work, where she led the charge in launching Guam's first licensure for social workers. Ms. Ramos uses her experience in program development, collaborative partnerships, human services administration, program evaluation, and community capacity building to enhance WesCare Pacific Islands, wonderful organization, which from my perspective has remarkably benefited from her experience and leadership in the field. Ms. Ramos earned her master's degree in social work from the University of Washington, and she also has a Bachelor of Arts degree in applied sociology and social work from Seattle University. Please join me in a warm Pago Bay Rotarian half a day to Ms. Aja Ramos. Aja, you got it.
Also today, and thank you everybody for allowing me to join this wonderful meeting this morning. I'm definitely excited to present to you today with regards to WesCare Pacific Islands and the services that we provide in the community. I know this aligns strongly with your ethos and with your charge to live out the service and community service and building communities through the work that you do with the Rotary Club. So I'd love to present. I actually have a PowerPoint presentation if I'm able to share screen. I can do that. Okay, let's see. Just 1 second. Believe it or not, I'm not used to Zoom. Our organization has signed on to a different platform. And so I usually attend Zoom meetings as an attendee, but not as a moderator. And I've never shared screens. So pardon my, my little delay here. So I want to talk to you all today about WesCare Pacific Islands. We're a nonprofit organization located at the Reflection Center, and we have a whole host of services that I think you'll find valuable in our community. I'll tell you a little bit about our mission and the types of services that we have, our array, and also end with talking a little bit about our challenges, successes, and ways that you can get involved. So WesCare Pacific Islands, we're a nonprofit organization that's broad-based, meaning that we have an array of services with various populations that we'll go over in a little bit. We've been established in Guam since 2009, and really the mission is to fill gaps in services in communities where it's needed, really targeting communities in need. We're affiliated with WesCare Foundation, which is a family of nonprofit organizations located across 16 states, 3 territories, the Dominican Republic and the Republic of Palau. And actually Palau falls under our umbrella, and we've been established there since 2015. We provide a wide spectrum of health and human services, from counseling to prevention services to working with veterans. We have a whole host of services that really targets various populations in need. We partner with like-minded and community-oriented organizations that also focus on providing the highest level of services. So we are in the community and have strong networks with other nonprofits to make sure that we're all coordinated in the way that we serve. Just kind of a little bit of a background, WesCare Pacific Islands actually started with a relationship to Sanctuary. Sanctuary was building their first youth substance abuse treatment program and sought out technical assistance from WesCare Foundation. Because WesCare Foundation throughout the states is really rooted in substance abuse treatment, they were able to come to Guam, come on island and do a survey and provide a plan for which Sanctuary can build what is now, I believe, their second home. And so they have a real kind of history with us here, got to know the community, and really were invested in looking at areas where they can contribute resources to the island. So it's a really strong history that started prior to 2009 and continues today. Just for an interesting graphic, this is where WesCare is located throughout the US. And as you can see down here, the territories, the Commonwealth, Puerto Rico, the US Virgin Islands, Republic of Palau, and Dominican Republic. So it's really the mission of the foundation is to look across the world, the big picture of the world, and see where they might be able to add value to the infrastructure that may exist, or help build an infrastructure that may be lacking in the communities that are in need. So locally, WesCare Pacific Islands, although we're associated with the foundation, we are all local. We're rooted in our local values, in our local culture, and in our people. All of our staff are rooted in the community here as well, and we have quite a diverse array of staff, which we're really proud of. And we kind of put the kind of buckets of services into treatment and support services and prevention services. And under that, those categories, you will see the programs that we have in place. So under treatment and support services, these are really services that helps the individual one-on-one. So whether it's a veteran seeking emergency housing, or someone looking to get tested for STI, HIV, and learn more about preventative measures, the treatment and support services is really about that one-on-one relationship with the client. Our prevention services are more broad scale. Those are really looking at providing education in specific areas. And the goal of the prevention services, and really in the field of social work, we look at, and I know through public health as well, if we put services in place, we educate about healthy behaviors, about how to make good decisions early on, then the problems that we might see later in life are curbed, right? And so the goal of prevention services is to start early and introduce these concepts of decision-making, of risk and resiliency as a way to kind of curb what may develop down the road. In terms of populations, we really look at 2 different categories. The first is adult services. And so the programs that serve adults, whether they're veterans or they're just persons in needs or people looking for counseling services, our adult services programs fall under that umbrella there. And then we have a whole host of youth services, which are mostly in the prevention field, with 1 counseling program as well. Oh, I'm so sorry. So just to give you a little bit more about the particular services that we have, I think WesCare, when people typically hear about WesCare, know a lot about our supportive services to veteran families. This is one of our signature programs that is really well networked in the community and really fills a niche in the community because we are the only program that is providing this in the island and actually in the region today. So SSVF, as it's referred to, provides services to low or very low income veterans, those who are at risk of homelessness or those who are currently homeless. And at risk really means they could be losing their housing in the next month. They could be behind on their payments, or they could be kind of couch surfing from family to family with nowhere to go. And those who are currently homeless, again, could be either living on the street, could be living in a hotel, or just really don't have any permanent housing. It identifies and addresses the immediate needs of the veterans that are at risk or experiencing homelessness and employs a housing first model. And the housing first model really looks at saying, we know people have a whole host of challenges when they're facing homelessness, but the first step is to really house them. We house them, get them into something that keeps them safe, that provides for their basic needs. And from there, we build the case management plan to help them and assist them with their other sustainable interventions, whether it be connecting to health services through the VA or connecting to counseling services or employment services. The housing first model really helps stabilize that first part of sheltering. We employ a rapid rehousing program. That means we really reduce all barriers for them getting in. We want to get them in as immediately as possible and put them up in a variety of options. So typically what we see is that the veterans who are literally homeless come into us and we'll put them up in a hotel for a temporary period of time while a housing case manager helps them to find something more permanent. And this is where we really try and establish a partnership with real estate agents to assist our veterans in finding something permanent and affordable for them. And the case management plan really assists them to do that. In addition, SSVF pays for their rent as they're stabilizing in those units to make sure that they have a solid income flow coming through, that they're connected to all the resources they need, and that they've got their feet on the ground as we start to exit our services. We serve about 75 veteran households annually. And over the course of the pandemic, we've served over 50 veteran families. We've had them sheltered, whether that's keeping them in the homes that they're in or putting them in emergency housing. And actually, I mean, it was pretty amazing. We established partnerships with 2 local housing vendors that are actually hotels. And at the time that everything shut down, the hotels were really struggling, and we were very fortunate that they were able to open their doors for our veteran families. And they did a great job, super welcoming in providing care packages and other things. And we were able to keep the veteran families there, keep them safe from the pandemic, provide them food and shelter as we kind of figured, as the housing market started to open and we start to kind of figure out how we can get them into something more permanent. In the year 2020, the fiscal year of 2020, 91% of the veteran families either attained or kept their permanent housing. And that is a very amazing outcome, that we're able to take people who might have been on the street or in a shelter or one of our emergency housing placements and bring them into permanent housing. The program works, it's effective, and it's very meaningful for those that we serve. Okay. We also have a mobile pantry. I'll talk about the challenges a little bit later, as we always have veterans who fall through the cracks, whether they're medically needy and frail and elderly and can't sustain placement on their own. These are some of the challenges that we find with some of our veterans who fall through the cracks. Igomata, so this is a partnership that we have with GURA. We maintain 5 units up in Jigo. It used to be the UP elementary housing for the staff at the time where they were where the students who were here from the military were also integrated into the public school system. They had housing for visiting teachers. When that all changed, GURA kept that housing and gave it to us to manage. And we actually, this is one of the permanent housing placements that we have for the veterans who come through the SSVF program. It's been pretty successful in that we've housed people there for many years. It's a great community. They have a very community-oriented atmosphere. It's well kept, and the families who are there have remained stable in their placement there. UPLIFT Counseling Services is something that is pretty new, but it's a program that started within the last 3 years. We provide behavioral health services to those who are in need. We have 3 licensed providers who provide mental health counseling and substance use counseling. This is a really important service for us, and it's growing. Through the pandemic, we've seen quite an increase in the need for behavioral health services. I'm sure you've all seen in the news, just the kind of crisis calls that come through Guam Behavioral Health really exploded over the pandemic. And we established a relationship with them to take on any excess referrals that we could, because they were just inundated with people in need of counseling services. In addition to that, through UPLIFT, we have a partnership with University of Guam. As the ISA Counseling Services Center was closing down, we took on the counseling for the students who were looking for support at that time. In addition to that, we have substance use treatment services with probation, U.S. probation, and the Judiciary of Guam. Our licensed mental health counselors and substance use treatment counselors are all trained in evidence-based assessments and in evidence-based counseling therapeutic modalities. We also serve private insurance clients as well. The next program we'll talk about is Emergency Food and Shelter Program, and this is one that we've been trying to get the word out on. We know that the pandemic has hit people very hard in terms of the utilization of food commodities, the lines that kind of just stretch when the pantries are open. So our Emergency Food and Shelter Program is a program through FEMA, and it assists low-income and at-risk persons with emergency shelter, food commodities, utilities, mortgage assistance, and rental assistance. The goal here is to really serve those who don't really have any other source of funding. It is veteran focused in that we're looking at those who, again, through SSVF, either they've kind of met their cap at the SSVF program, or they don't qualify for SSVF. They would qualify for this assistance. And luckily, with one of the CARES phases, we were able to open that up to the general community and assist where places like Salvation Army ran out of funds. And so we were able to step in and provide that for those who are in need through our EFSP program. And we still have funds available for this for those who might be looking for that. And that includes mortgage assistance. And that's really important because a lot of the assistance that you see might be for rent, but this one also can address those homeowners who are struggling to make those ends meet. The Guam Project is the HIV, AIDS, and STI testing program. It's in partnership with public health. We provide confidential and really discreet testing environment. Although through the pandemic, because of just COVID-19 protocols, we've really turned it over back to public health. But one of the things that we continue to provide is risk reduction counseling. And so those who kind of want to take a look at sort of the patterns and ways that they could prevent any sort of HIV or STDs and where they can go for resources, we still are able to provide that at this time. We also do training in the community. We go out to the schools and provide some training on medically accurate STI and STD information as well. So now we're going to get into some of our new programs. WesCare has actually really grown in the past year. It's interesting because we've added at least 4 new programs during the pandemic, which has been quite an interesting time to launch a new program and hire new staff. And the one that we'll talk about right now is Malignant Malignant. This is really a partnership with Guam Department of Education in looking at their behavioral health data and seeing the number of referrals for discipline, the referrals that were coming into the schools for students who had been suspended for alcohol or drug use on campus. really led to our partnership to find some treatment services for them, because we know that DOE has started a behavioral health program, but the need continues to be very high. So Malignant Malignant is a program that's funded by SAMHSA, and it really grew out of a disaster response grant because of Typhoon Mangkhut. But what it's kind of morphed into is that the disaster we're facing now, and what's the most pressing that we're seeing for the students, is the impact of COVID. It's a trauma treatment program for youth in middle and high schools, and it provides critical mental health support and specific treatment for our vulnerable population. It's a school-based program in 3 of the different schools. We're currently at Ukuru High School, FB Middle School, and Benavente Middle School. And really what it is that we're there on site to the schools to be of service of any crisis situation that arises, and to really identify those students who have faced significant trauma and provide therapeutic counseling in the most accessible way possible on site at the schools, and that we involve the school teams to be able to have an integrated approach to the healing and the resiliency building of the children that we serve. Our goal is to serve 150 students under 18 months at 3 different school sites, which comes out to be about 50 at the 3 sites. And what we've seen is that we have other schools who are asking as well. And so we're looking at extending 1 site to JFK, especially as the school start to open up. We're going to start to see more of the need and the ability of the counselors to identify these students. And so we'll be there to assist and provide that counseling at no charge on site at the schools. Project Casata is one longstanding youth program, and it really focuses on teen pregnancy prevention. Unfortunately, Guam still tends to be in the high on the list of areas that are impacted by high rates of teen pregnancy. And so our goal is to go into the schools, work with them, and provide the education on how to make healthy choices, to understand what healthy relationships look like, to give them information about STIs and HIV, and to promote just general awareness of boundaries and positive decision making. We've served over 1,200 youth so far over the course of 6 years, both in Guam and in Palau. We're currently at Jose Rios Middle School and Agata Johnson Middle School, and it's a great partnership with those schools. We go into the classroom and teach during their character development, and the students have been very responsive. In addition to that, we provide a mentoring day. So if anybody wants to get involved in that, it usually is a great event where we have mentors and they have a group of kids, and we do fun activities and they get to share their stories, and it really is impactful to the kids that we serve. Another youth program we have that's very similar in scope as PrEP. This one focuses more on an abstinence-based approach. Is Ilina Lahu, which means my life. And this really, again, targets kids in the middle school, providing mentorship, education on, again, refusal skills, making healthy choices, understanding healthy relationships and boundaries. This one is aiming at serving 200 youth, and it's a new program to WesCare that's just launched in Agata Johnson Middle School. And this really came out of the school saying, we wish we had more of you. You know, we only had 3 bodies going into the school, and so we're limited in terms of our reach. And they said, you know, this approach really works with their kids. We see quite an impact on them. They're able to share stories of how youth were able to make more positive decisions and give more thought to the decisions that they were making. And so we applied for this grant and were awarded the grant through the Administration of Children and Families to extend those services in the schools that we were working with. The Thrive Coalition, some of you may have heard of. This is a coalition for a drug-free Denido, and this is more of a community level change program. It isn't that direct one-on-one service with the youth or with the adult. Really what it is bringing together 12 sectors in our community, and that could be business sectors, other nonprofits, governmental organizations, the Department of Education, GPD is actively involved to really look at the youth risk of the use of alcohol marijuana, and tobacco. And we put in strategies at a community level to be sure that students have the information and that the community is drug-free. So promoting substance use-free use amongst youth. And some of the things that they've been able to do are really cool. They had a big cleanup in Dedido. So the goal was really to have, looking at the environment, an area where youth would be drawn and families would be drawn to come in and use that, right? And have a place where they could call sort of like home. And they went to the Estimbo area and cleaned up the street and cleaned up around the baseball field. And it was about 70 volunteers who came out and did that. The next day of the baseball field that hadn't been used in forever because it was just dirty, it was overgrown, there was trash everywhere. There were families out there using the field, on there playing baseball. And one of our staff even snapped pictures because she lives in the area and she was just so proud of the work that was done there, because for the longest time it went unused because it was just unsightly. And so these are the type of strategies Thrive Coalition puts in place. They're sponsoring a summer camp with GPD and also hosting forums for families to understand sort of what the youth are facing today and what the community looks like. We did an environmental scan to find out things like how many mom and pop stores are advertising alcohol and how close are they to schools? How many parks are there in Dedido, and are there signs that say that this is a drug-free, alcohol-free zone? And so the Thrive Coalition is doing that work now to implement those things in the Dedido area. Building off of that is the Malignant Malignant program, which also focuses on community level change, but extends not just Dedido, but throughout the northern and central regions of Guam. In addition to that, they also provide the one-on-one services that the Thrive Coalition doesn't, using evidence-based programming to 250 youth served annually. Right now, they are working with St. Paul's to be able to provide classes to the students about drugs and alcohol using the positive action curriculum. In addition to that, you'll be seeing that they're doing a needs assessment and environmental scan, much like Thrive Coalition did, but throughout the northern and central regions. Again, looking at advertisements of alcohol in areas where students are, looking at parks, and putting in community level change. In addition to that, what you'll be seeing is a champion campaign where we're really looking at community organizations and individuals, influencers in the community who promote a drug-free, alcohol-free lifestyle. And we're going to do a big campaign in the community with media and other things that are involved to really highlight the champions and really promote that to the youth as positive role models. So again, this is a new program with WesCare that is just launched. And that's the whole array of services we have. I feel like that was a lot. Whenever I give the presentation, I know it's just kind of like an overwhelming feeling of all the things that we do in the community. We do provide a lot of services and they are very meaningful. Every year we put out satisfaction surveys to our clients and also to the community, and it's all been positive results. I think some of the challenges that we face, as great as the services are, they're also limited. So all of our grants are federally funded, and that is always limited term. And those who have dealt with federal funding know that they come and they go. And so sustainability is always a challenge for us. In fact, we had a program that people still ask about that was focused on promoting healthy marriages called Spark. We did retreats and served over 200 couples in Guam. But because of the federal funding that expired, we were not able to continue that program. So oftentimes, you know, nonprofits, this is one of the big things we face. We have programs that have great impact, but we don't have a way to sustain them. And part of that is because the local funding opportunities are truly limited. We're not a governmental organization. We don't have an appropriation. Contracts with the government of Guam through Guam Behavioral Health and through other entities are also pretty limited. So it really is a challenge for us to sustain these programs without that backing. Another challenge that we face are clients who fall through the cracks. And so we may have an array of programs, but they may not fit those programs. And so we're often challenged with clients. For example, we had a mother who is fleeing domestic violence, who's a veteran, who we housed in emergency housing. She got a voucher through GURA, through the GURA programming through HUD-VASH, which is a partnership with GURA, but she wasn't able to move into that apartment for a good 2 weeks, and we couldn't no longer pay for where she was staying. And so we kind of had to figure this person could easily go back into homelessness if we didn't figure out something quickly. And that's where things like donations and money that we raised through fund development and fundraising help to capture those clients who fall through the cracks, where we were able to pay for that continued stay at the emergency housing for those 2 weeks until she was able to go into the permanent housing placement. Some of the successes, though, which are more exciting to us that we love to celebrate, is that we have mission-driven and dedicated staff who go above and beyond. They're really dedicated to the work that they do. A lot of the feedback that we get from the staff is that they're happy to show up to work every day because of the services that they provide and the lives that they touch, and seeing sort of that end goal being realized. You know, when a mother, as I said, escaping domestic violence, who gave her service as a veteran, is housed. So those types of things are meaningful, and really the passion in the work that we do is evident. We have very strong community partnerships. We're very well networked with Guam Behavioral Health, with Guam Department of Education, with Sanctuary, with Island Girl Power. The mayors are a big champion of ours. And it's those partnerships that really help us kind of extend and identify the areas of needs where we can come in and offer services. We have success in our program delivery. And so I'm really happy that quality assurance is a huge value of ours. Our programs are always looking at what we're doing well and how we can improve, and making sure that we're as innovative as we can be and creative as we can be in our service delivery. And finally, our client satisfaction. As I mentioned earlier, every year, and actually with the youth, it's every cohort we serve, we provide a client satisfaction survey, and all of them come back very happy. They feel that the services that we have in our community are meaningful and have made a positive impact on our lives, in their lives. So we encourage you to get involved, and several ways that you can do that is to volunteer. I think I made mention of the cleanup that happened. So any type of event that we have in the community, you are welcome to volunteer. We're always looking for helping hands. Donations also help go a long way. Again, those discretionary funds that come into play when we have families in need who we really want to help but may not fit that specific requirement. Donations go directly to those clients to help them in those times of need. Making connections. And so if you see an opportunity for WesCare, and you know, Dr. Lawrence Camacho is great about this. Making connections. If you see an opportunity for WesCare to be involved, or an area in the community that you feel would be a good fit, we are more than happy to take that on, to have those discussions, to see where we can help. And of course, spread the word. If you know anybody who could be benefiting from the services that we have, please let them know about that. Let them know that we're out there and that help is here when they need it. And that's all I have. Here are ways to connect with us: our email, our website. We're big on social media. Many of you may know about TikTok. We also have one of those. So please contact us with any questions that you may have. And I see hands.
Okay, wonderful. Thank you so much, Asia. We really enjoyed your presentation. Such a huge portfolio of many different kinds of initiatives and projects. And I see how our Rotary E-Club can be instrumental in being a partner in some way. I want to open up the floor to our Rotarians who may have questions. I know it's already at the top of the hour, so very grateful for those who stuck around.
Hi, good morning. I'm Mary Kate. I actually really commend everything that your organization is doing. I think it's fantastic. As someone who's currently serving in the Army, I'm I really commend what you're doing for veterans in need. And I was wondering about with their proof of service, does it have to be like proof of honorable service, or does it active duty? Was it reserve time, guard time? Are those factors at all?
Yes, those are definitely factors. And this is what I'm saying about those who fall through the cracks. So there is a service requirement, and there is a requirement for an honorable discharge. So if we have those clients who do not meet those requirements, they would not be eligible for the program. And oftentimes what we would do is try and refer them then to that emergency food and shelter program, which is a nice kind of cushion for those who do not qualify. But there are those specific requirements, yes.
Fantastic. Well, thank you.
Thank you. Any other questions? Dr. Annette, you had your hand up.
Thank you very much, Asia, for your presentation. If there's a particular program that requires immediate help and assistance, what program might that be? Or maybe give us a list of your top 3. I think that might help President Anita and the rest of our Rotary to maybe focus some response strategies to assist.
Sure. I think for us right now, our biggest sort of worry are 2 expiring grants that we want to be able to continue. The first is the one that's been pretty long-standing, 6 years, the PrEP program, and that's located that's implemented at DOE, and that's a teen pregnancy prevention program, which has been very successful and served over 1,200 students, both in Guam and Palau. That is set to expire in September, and so we're currently looking for some sustainable strategies. I know there's a bunch of CARES funding, or I'm sorry, it's the rescue plan funding, I believe it is, that came out, and I've been in talks with superintendent about how we could potentially be a part of that and offer perhaps after school programming, summer programming, to help sustain what we've done with PrEP, and offer that to the students to address those social emotional needs. The other one is the Malignant Malignant, which is our trauma treatment program, which the challenge for that is that it started during the pandemic. The pandemic hit, kids weren't going to school, and it's a school-based program. It really is meant to be on-site crisis intervention, triaging students, providing group counseling and one-on-one trauma treatment counseling, which we know they will need. We know as they start to come back to school, the students are going to start to be identified, and we're going to see behaviors, withdrawal, and our grant will be expiring in October, and so those services won't be available. We do plan on applying for no cost extension to at least extend out till December, but that program is sorely needed in our schools. And so any support we could get on sustainability of that one would be great. And just so you know, we work very closely with Nadine Cepeda, who's a huge champion of ours, and it's really helping relieve the work within the district to meet the needs of the kids that they can't. So it's an important program, and it's unfortunately going to be coming up soon.
Okay, thank you. That's very good to know. Do you folks have an annual fundraising event that you hold?
So we had one. It was actually a really cool concept. Some of you may have attended the Bahaki Ball. It's literally, the goal is to show up at, it's supposed to be a gala, but it's supposed to be Bahaki. So some do come in slippers. I believe the Congresswoman Madeline Bedalia at the time came in a bathrobe. And so it was really our signature event for fundraising, but due to the pandemic, our board we've chosen to kind of not pursue that at this time. Number one, because we can't do that in person, and to maximize the event, we really need a lot of people to attend. And also because at the time, the economy was struggling and sponsorships were going to be pretty difficult for, the scale we were going for. So we are currently discussing what our next fundraising event will be. We're hoping that the Bahaki Ball will come back into play in some form or fashion, perhaps around Veterans Day has been the discussion. So.
And bear in mind that you could do a virtual Bahaki Bowl. The university has been very creative, in terms of having virtual events, because we can't meet face to face, and that there's a possible partnership there. So we'll keep you in mind with regard to being able to at least hold that signature gala this year. I hate
Yeah.
for another year to go by, not be able to take advantage. And so folks have been having virtual happy hours. They've been having virtual paint and sip events as part of a fundraising initiative. And virtual conferences. So it's very possible. We do use Zoom or a different kind of platform, but we have a machine that makes it happen. We do have folks in our Rotary Club who have access to those particular services. So I'm glad Rotarian Dr. Annette had asked that question. I think there's a way that we certainly can be a partner to WesCare. And I just want to say that your organization has come a long way. I remember back in the days of Sanctuary and WesCare with Sarah Thomas Netadog, and all the humble beginnings, and being a participant in one of the weekend initiatives with one of the not an adopted person, but a foster middle school child. So I participated.
The mentoring event, right? Yeah.
Yes, and I have to say that I wanted to be the Nina for that particular student, because I learned that she loved reading books, and I wanted to provide a perpetual scholarship for her to access the books at bestseller for as long as she wants. So they never did get back to me with her name. I don't remember her name, but that was the only thing that made her face light up. And so I figured that was probably a way that I could continue to sustain her interest in literacy and certainly literature.
I just this is Lawrence. I just want to say that as part of Asia's advisory council, we're in the middle of strategic planning. I'm sure she's going to be introducing that as well. But in our strategic planning, I can see how we can incorporate the Rotary Club here to be a leg to that planning process, to include the one that Mary Kate had just she and I were chatting back and forth on the Skills Bridge program for military as well. So we see, obviously, just through this conversation this morning, 2 opportunities already that are starting to become fruition, evident that we can include it into our strategic planning, as Asia had started commencing with us on over.
Okay, wonderful. Thank you. I see 2 hands up. Rotarian Dr. Ron and also Rotarian Mark, but we'll begin with past President Ron.
Thank you, President Nia. I just want to mention, you mentioned a Bahaki ball also. Well, I was just going to mention that Dean Lawrence is in his house coat and slippers all the time. I just wanted to point that out. Thank you.
That's right. Dean Lawrence is a very active participant in the Bahaki Ball each year.
That's why he's a perfect person to be on the board for that. So
is that why you come in your Joreets to campus, Dean Lawrence?
I'm upgrading as the day goes by, right? So as meetings start to become more face to face, my wardrobe continues to be improved again. Come out of it.
Right. Thank you. Okay, Rotarian Mark, you have a question?
No, I actually just got a comment. I just want to thank the WesCare family. They helped us out at the residence halls, and so we do encourage our students, those who may need this type of services. And the other thing too, I really like is a lot of the Chamorro. I learned a lot of Chamorro words this morning. It's really tied to the community. So I think it's really cool. I think that's one of the things that, especially when you localize it like that, and people ask questions about certain things, it's really cool. I just want to mention that. But the services do work, and their intake process is simple. It's easy enough to refer people that may need those services. So encourage anybody who may need their services. I mean, I didn't know until, of course, Dean Lawrence and I met with Aja. And so we were able to utilize the services. And they actually even had a session with our students. They came in and talked about their services. So it's great to have community partners like that out there, especially with all this stuff that's going on with the mental health issue. And then also with the Department of Ed. I appreciate the work that's being done there. Thank you very much. Have a wonderful day.
Thank you.
Thank you so much. Now, I know that we've already lost quite a bit of people. It has been the top of the hour. Thank you so much, Asha, for being our guest speaker today. We certainly have learned so much and very excited about all these initiatives. We want to see how we can assist in a very important way. But I do thank Dr. Lawrence for being very patient and scheduling basically the time for you to present. But with that, on behalf of the Rotary E-Club of Pago Bay, Guam, I want to extend a Sindaglu Masi. Thank you very much for your service above self and all that you do at WesCare Pacific Islands. And we'll be sending you something very soon. So with that, everyone, that concludes our meeting for today, and have a wonderful, safe, and blessed rest of your weekend. I'm going to go ahead and ring our Rotary bell.